What's up, guys? It's Dominique, aka That Therapist. For those of you that don't know me, I'm the lead clinician and CEO for a group practice known as Yellow Bird Counseling. Well, what is that? What's the Yellow Bird Counseling? Well, our normal day-to-day activities include providing individual, couples, family, and group therapy for children, adolescents, teenagers, adults, young adults, elderly across the state of Alabama. But what do we do here on social media? Well, sorry y'all, my hair got my glasses not seeing. Hold on, y'all. Okay, there. What do we do on social media? Well, every Thursday at 8 p.m. Central Standard Time, which is 9 p.m. Eastern, which is 6 p.m. Pacific, which is 7 p.m. Mountain, we discuss topics that the general population can relate to and tie it back to how we could all use a therapist outside of simply just having a mental illness. Because y'all know how y'all think. Y'all think that something has to be quote unquote wrong with you in order for you to see a therapist, and that's simply not the case. So we take you through different scenarios each week that someone may seek therapy even if they don't have a mental illness. We also are a large advocacy practice for our BIPOC and LGBTQ community. So with that being said, I was doing a little perusing, you know what I'm saying, around social media. And on one of the platforms that I participate in, I think it was last week or the week before, it was a significant amount of misinformed people about our transgender population, which, of course, is totally on brand for Yellowbird for us to be advocating for transgender individuals. But there was a lot of people that were misinformed or uninformed, and because of that, it resulted in a display of transphobia. So we're going to go through all of those terms tonight, but I thought that since everybody's concerns with transgender medical care goes back to children, I think that I'm going to take the perspective of gender affirming care for youth, since people seem to be concerned about how gender affirming care could be helpful or harmful for our youth. So that's the perspective that I'm taking. So please tap the screen, share the live. If you know anybody that could benefit from this, maybe you have a loved one who is transgendered or a child who is experiencing their identity as being transgender. So definitely please tap the screen, share the live to your uninformed friends and family members who may have expressed a level of transphobia simply because they are ill-informed. So we want to get those people in here so that we can educate them truly on what it means to provide gender affirming care for our folks in the transgender community. But I'm not going to be doing that by myself. Okay? A lot of people, all of my people that work for Yellowbird are passionate about marginalized communities like myself. So oftentimes they will volunteer to join and help me on topics that they are also passionate about. So I do have one of my Yellowbird ambassadors, okay, who has recently switched their focus a little bit as far as population that they work with, but had always shown a passion for transgender clients that they worked with when they were primarily working with me. So without further ado, let me bring them on. Hey, Dana.
Hi, Dominique.
How you doing?
I'm cold. I hope you'll pardon my giant blanket.
No, you're fine. You know I don't care about that. How you doing?
I'm good. I'm a little sick as well. So, hi.
No, take it easy. Thank you for
Oh,
joining me, even though you're under the weather.
my dogs are very excited to be here with us. So,
Yay! We got the dogs. Everybody's here. We're going to get this done together. So,
we're gonna have a good
again,
time.
I asked Dana to come in very last minute. Part of this is because there's going to be a live discussion going on
Ooh.
Saturday by Poetic RN, who y'all know is the RN that works in endocrinology, and she's going to be bringing her endocrinologist doctor on there. But before you can even start receiving HRT or any reconstructive surgery, you do have to go to therapy first. So before you even get to Poetic RN, you got to come through me, right? So please tap the screen, share the live. We're going to start with what does that look like, okay, to receive gender affirming care, specifically for our transgender population. Introduce yourself first, even though I already said who you are. Introduce yourself to us.
Um, so my name is Dana. I use they, them pronouns. I have been a therapist for about a year now. I started with Dominique in my internship. And so we've been together for about 2 years now. Um, my passion areas include teenagers, transgender clients, and queer folks in general, as well as neurodivergency. And currently, I'm working in a substance use population. And so I see a little bit of everything working there because substance abuse can affect anybody. So,
Exactly. So Dana is broadening their horizons with clinical care, getting a lot of experience with a lot of different populations, which is really going to help them
yes.
as they grow in their profession. Well, Dana, tell us specifically about your passion of working with transgender individuals.
So, um, transgender is such a broad term. It's a lot more than a lot of people tend to think it is. Anybody who does not quite feel like they fit with the gender they were assigned at birth is considered to be transgender. And so people who identify as agender is like they don't feel like they really have a gender.
Mm-hmm.
People who are non-binary, which just falls anywhere outside of A or B, tends to be is also referred to as transgender. People who do surgery or hormones or to switch from one to the other within the binary is transgender. And so I think it's just, my experience as a non-binary person, as well as, a lot of the experiences that I've had in my life made me come to realize that that's an area that I have a lot of knowledge and experience in that a lot of other people may not have, and where I could lend my talents really well. And so that's kind of been where I started with that particular niche. But I really just love focusing on areas of change and helping people through the different changes in their life. And oftentimes, when you start hormones or your transgender journey, it's often like doing puberty again. And so it goes back to my love of working with teenagers. And so
Mm-hmm.
it's all kind of just connected. There's also a very high rate of neurodiversity in the transgender community. So it's all just kind of intermixed and mashed up, and it's a mess, and I love it.
Loved it. And so I knew that was Dana's passion. So I was like, not only will it help the general public for us to kind of hit it from the approach of like transgender youth, because people, as far as with policies and things, that's what they say. Oh, the children, don't let the children. And it's because they're ill informed of what gender affirming care looks like and the steps that it takes and the details of what that kind of treatment looks like. So they tend to think it's going to be harmful because it's not like them.
Mm-hmm.
They see it at the general population. I'll say the 99%, and we'll just put us all that are not that don't fall, that are cisgender, because there's 99% of us are cisgender. um we tend to think that because we're in such high prevalency that everybody should be like us, when that's simply just not the case, which leads to a significant amount of what we refer to as transphobia. So, Dana, if you don't mind, you can, if you'll define for us, if you can, what transphobia is, so people, because they're also misinformed about what transphobia is and what it can look like. This is for us 99% cisgender people.
Whenever I think of phobias in kind of a, transphobia kind of way, I often think about it as the fear of something that is different, right? It's often just this lack of understanding and the kind of jump to conclusions and blowing up kind of worst case scenarios that we see with that. Kind of like how we would see with the what am I thinking of? The reefer madness. Reefer madness, right? It's something that we don't understand. And so we've been told that it's bad. We just kind of villainize it and blow it up and all this stuff. And so this kind of lack of understanding leads to this kind of fear and aggression around people that are different. And we see that a lot right now with trans folks, whether it is gender-based violence or with the fears and concerns about women's sports or bathrooms, like,
Oh my gosh,
so,
the bathrooms.
like, oh no.
Which is weird to me, because who is going in and looking at people's privateness in a stall?
I don't know what people do in bathrooms. I just go and pee and wash my hands, and I don't even notice if other people wash their hands most of the time. I just get in, get out.
We're pretty, it's a pretty tunnel vision thing, especially in a public bathroom. We're not like checking out the sites, checking out the people. Usually anybody is going to the bathroom with one thing in mind, especially if they're using a public bathroom.
Not there for the sights and smells, for sure.
Right. Really not. It's not a place to pick up a hot date, usually.
Usually.
But that's what people think that happens with folks that are transgender when they're using the bathroom. They think they have this sort of motive when they use the bathroom, which is like, no, they're just using the bathroom like us. So, but yeah, to kind of expand on that, let me explain to you guys over here more detail about transphobia and what that can look like, because y'all might not think you're exhibiting it when you are. Generally, I'll say to not devalue. That's not the word I'm looking for. Disregard someone else's gender, which we all know gender is a social construct, and those doggone birth certificates got us all effed up because they were putting gender as opposed to sex, I think, on there is what was happening. And so people are thinking that you're born woman or man. Shout out to the women or non-binary folks, or not even women, maybe other trans people that are bearing full men and women when they're giving birth. Shout out to you for being able to push out a whole man or whole woman when you are giving birth, because that is just a feat that I don't think, me personally, I would want to endure. It sounds very painful, but I digress. So people typically don't understand the difference between gender and sex. They're conflating the two, which I understand, but it's important when we talk about this topic to know that there is a difference. Gender is what socially and psychologically we identify as. So it's a social construct, whereas sex, okay, male or female, is a biological concept. And sometimes people don't understand them to be two parts of a whole. they think that they're one and the same. So hopefully that helps. But let me outline some of the behaviors that transphobia can consist of. So a negative attitude towards transgender individuals, negative feelings towards transgender individuals, or actions towards transgender people, or transness in general that are negative. Excuse me. Transphobia also includes a fear, not just a fear, but it can include a fear, aversion, hatred, violence, or anger towards people who do not conform to social gender roles. Transphobia is a type of prejudice and discrimination. So that's what I was looking for. Discount. If you discount someone else's gender and say that they're less man or less woman than a cisgender person, that is a form of transphobia, because you're discounting, you're discriminating them, you're othering them. So that's a form of transphobia. Similar to racism, sexism, ableism, and it's closely associated with homophobia. So whenever you're othering or making someone that is transgender feel that they're not as much whatever gender they identify as a cisgender person, that, my friend, is homophobia, right? I'm sorry, transphobia. So just to kind of outline that a little bit more so that people understand the behaviors that they're engaging in when they may not realize it. Dana, do you want to expand any more on maybe what specific actions might look like of somebody who is transphobic?
I was thinking about when you were talking, some people, this is more sexism, but they're like, oh, like you're not a real man if you wear pink, right? Or if you don't drive a truck or whatever. It's the same kind of thing that we see with that. It's that kind of making someone out to be lesser for a certain reason, for whatever reason. That's all of the isms that we see, where it's just, even if you don't believe certain things or feel like you hate people because of these things where you're like, well, trans people are less, or they have lost something in being trans. They're not like whole or real anymore because they've had these cosmetic alterations or hormonal changes or whatever it is.
Well, that, and another point is saying that it's a choice. That's a big, that choice word in the transgender, well, the LGBTQ community as a whole.
Yeah.
Heterosexual folks, cisgender folks have this idea that it's a choice for somebody who's transgender to be transgender, or somebody who is LGB or Q or IA, that's a choice. I want to ask y'all something. Who would choose to be marginalized? Who would choose that? That's a real question. Who would choose? Y'all can put it in the comments. Who would choose to be marginalized, right? On top of that, there is a scientific portion. When we look at, and I'm not going to bore y'all with all the science, but look up the function. Go ahead. Okay, Dana, you want to go with the I was going to go with the hypothalamus function. You can.
I don't know about the hypothalamus. Tell me about it.
Well, so that's the part of our brain that handles sexuality, gender, orientation. That's a part of our brain where that develops, and oftentimes we don't know that that's a function that develops in utero, but we become aware of it when we're born at the ages that we would become aware of that. A lot of you will be appalled to know that we all, cis and transgender people, are alike. become aware of our gender and where we feel that we fit between the ages of 3 and 7. Very young. Very young. Go ahead, Dana.
I also tend to ask people, when they believe that, it's a choice, at what point did they choose to be heterosexual or cisgender, right? Like, it's something that is placed on us from a very young age, that this is how it is and this is how you are. And to go against that is pretty daunting for a lot of folks, right? We're not at any point taught to challenge these things and think about them. And so for a person to go through and think about these things and believe and come to believe that there's something different is, a pretty radical act of self-understanding. And so, oftentimes we think about things being very permanent, and they don't often have to be. If somebody wants to, if a boy wants to start wearing skirts and just kind of see how he feels, like, the heck, it's allowed to just be a phase that they go through, right? My emo phase was not a phase, but a lot of us had emo phases where we just kind of
I did
this
in
way
high
for a while.
school. I remember those bondage pants.
For me, it was not
Black
a phase.
eyeliner.
It was still a lifestyle, but still. Yeah, I mean, a phase can just be a phase, and we can just kind of try things and decide if it's something that suits us. It doesn't have to be kind of a huge deal. And, there are points where you do, as, whether you're heterosexual, bisexual, homosexual, you do have the ability to choose who your partner is, right? And as a transgender person, you do get to choose what your level of change and care and what your presentation is, in the same way that we all choose what our presentation is when we choose what clothes we're going to put on in the morning. And when I chose to put on this giant blanket before I came to this meeting, but it's ultimately not a choice who we are on the inside, and it's only a choice how we express that outwardly. So.
Absolutely. Before we move any further, is there any questions? Do y'all have any questions that we can answer? If y'all over here could please share, if we could get to like 40 shares and 10K taps, y'all think we could do that?
Are the comments on right today?
Oh, let me check. Dana, hold on. Dana. Thank you, Dana. Sorry, Dana released y'all from comment jail because I forgot the comments were on sub only. My bad. Thank y'all. Everybody say thank you, Dana. Thank you, Dana.
You said hello to me one day, and I was trying to say hello back, and it was just like, you have to pay money to do that. And I was like, no.
Yeah, I didn't know. I thought it would reset after I end the live. It would reset to not sub only, but it doesn't. You actually have to manually turn it off. So if y'all could tap the screen to 10K, share the live 40, that'll be great. Thank y'all. I appreciate y'all. All right, cool. So since we are, well, Dana, do you have any other points that you wanted to make about the scientific perspective before we went forward?
I did a little bit of research about the different kind of medications.
Perfect. That'll be good. They can take that. People over here can take that into the live on Saturday.
Mm-hmm. Yeah, it's a good introductory. So, oftentimes when we think about gender affirming care, we think strictly about medical care, right? But oftentimes that isn't where it starts, right? Even before they get to us, right? And so we know that there's medical care, and then a lot of people know about hormones and puberty blockers and, stuff like that. A lot of people don't know that you have to see a counselor and get kind of an assessment done before you kind of get to those, just to make sure that you are stable. But oftentimes with the youngest trans folks that we see, the children who are pre-puberty age. Oftentimes for them, gender affirming care can just be, a wardrobe change, maybe a haircut, maybe choosing a name that they feel suits them better. But that's something that we all do, right? I don't like the way I look with long hair. And so I keep my hair cut kind of short because that suits who I am, right? Um, I've always been a little bit more of like a tomboy. And so I don't wear a lot of dresses and stuff, except occasionally when I really just want to. And so that for me is part of my gender
Hey,
expression.
Poetic. Sorry, Poetic is the one doing the live on Saturday. Go ahead.
And so, gender affirming care can be whatever it is for you, right? It's however we express our gender. Um, did you say something about dysphoria already, or?
Not yet. We haven't. We're going to do dysphoria last. Yeah.
Um, but so, whatever it is that brings you happiness in your presentation, right? Some girls really like to wear those pretty frilly dresses where they switch. My husband probably just got home. Sorry. When they like twirl, it like swishes around and does all this stuff.
Dana got to get their dog straight. Mr. Carter, don't you start.
I was watching a TikTok earlier and there were some dogs barking and they started freaking out. They'll bark about anything. But so, gender affirming care doesn't have to be medical care. It can just be, I don't like my first name, so I go by my middle name. That's, something that is affirming to you. And so we all choose the way we present, kind of like what I was talking about earlier. As they get more into kind of puberty age in states unlike Alabama that don't have laws restricting what we're allowed to do for young folks, the next option is puberty blockers. And so puberty blockers have been used for a long time on folks that just like start puberty way too early. Like if a girl starts puberty at like 9, they're like, no, like we're not doing that. And so
y'all bear with Dana. They have not been feeling well. They're doing me a favor.
I may have to go get some water. I'm doing okay right now.
Yeah, go get you some water if you got to.
I'll do it in a minute. Okay. But so like puberty blockers have been used for a very long time and they've been scientifically recognized as very safe. I was looking at it earlier because I'm just that kind of nerd. That like the actual hormone that they use in there, the actual medication that they put into it, only has like a hold on.
No problem. Dana's going. It has to get some water, y'all. But we're on puberty blockers. The thing that those of you that aren't very well versed are scared of puberty blockers, thinking they will harm your young person. But Dana is actually telling us that puberty blockers have been used for children other than transgender folks. Like, for instance, if a young lady starts puberty at 9 years old, then their puberty blockers can be administered for that sort of thing. Go ahead, Dana.
So I looked it up this morning because I was just interested. They actually have to do a lot of different things in order to make the medication last for a certain amount of time in the body, because the medication only lasts for like 3 hours. And so with both the placement of the injection being in, places where it'll absorb more slowly, and adding things in that make it release more slowly, because it actually works really, really fast and is gone from the body really, really quickly. And so generally the shots that they give are either like 1 or 3 months and you have to go in. And so basically, if you don't go in on time, you'll just automatically restart puberty. Jesus. And so, that's kind of the first level of care. And if somebody decides at some point that they're ready to undergo puberty, or if they've decided that, this isn't right for them, they can at any point just kind of stop going in and getting it and go through their gender assigned at birth puberty. I am going to go get some water.
Yeah, okay. Perfect. We're still on puberty blockers. If y'all have any questions while Dana go get some water, please feel free to put them in the chat. The comments are not on sub only. We're at 17 shares. Can we do 13 more shares? Can we do that? I don't think that's not right. I'm sorry. That only would, that would, no, that, can we get 23 more shares? My bad. Can we do 23 more shares? Does this vary state to state? Yeah. Dana just said that as far as with and that poetic, but in Alabama, we're a very red, conservative, in God we trust state. So we're very limited on the amount of gender affirming care we can provide to children in this state. But maybe if you go somewhere cool like California, of course, there's going to be more access that folks would have. Hold on. Why did it? If it screens your comment, that's not me. I'm down the rabbit hole and it's irritating. What part? What part you down the rabbit hole about? The research? I've been on the rabbit hole with the research too. Illinois, you can go through Planned Parenthood. Oh, really? Oh, different state laws. I'm only familiar with mostly what you can't do. Because again, live in Alabama, super red. In God we trust. Go ahead, Dana.
Got me some water and some cough drops, so we're gonna make it.
Yay!
So generally after, puberty blockers, the next step will be hormones. And oftentimes that's when I've been getting clients to see me, right? And generally at this point, they have been for a little while presenting socially as their preferred gender, or, as the gender that they actually identify with. There's some discrepancy. There's some argument over the word preferred.
Like chosen.
Yeah.
Yeah.
And so, they'll be using these pronouns, their name, the presentation that they identify with, and have decided that that is something that they want. Hormones are a little bit more serious than puberty blockers. And there have been lots of studies. I've listened to multiple podcasts that talk all kind of about this kind of stuff. But in the same way that a innate puberty that you would go through with your, biological sex from your normal phenotype and everything, or genotype, is permanent and can cause permanent changes. Like there's nothing I can do right now that will change my current development, right? And so nothing other than surgery is going to get rid of my chest. And so with hormones, we have to be a little bit more careful. And that's why they often recommend more scrutiny, more testing, more of that. And so oftentimes that's when people come to us. Mm-hmm. Generally, what I look to see is that the presentation is consistent, that they understand the implications of starting hormones and kind of the risks versus benefits. And this is something that they really want. If they're still unsure about being transgender, if they still have negative ideas about changing or about their body or about what they want, I would recommend holding off, right? Until we can kind of work through that and decide that that's something they want. And so, even as somebody who is myself transgender, it's not something that we just kind of rush people into and like, yeah, it'll be great, go for it, right? And so, I think I would like to believe that that's how everybody is. And from everything that I've seen, there's often a very like abundance of caution used in recommendations. So,
Yeah. And let's talk about that a little bit more. Y'all might hear us throw around the term HRT a lot. That's hormone replacement therapy. That's not just for transgender people, right? I mean, we got if you're what you call it when you're taking birth control, okay? Women, if you're on birth control, right? Hormone replacement therapy. If you go to an endocrinologist, which y'all are going to talk to Poetic RN and her doctor on Sunday more about the ins and outs of the endocrinology piece. But people see an endocrinologist and receive hormone treatment for other things. So you, my friend, could be undergoing HRT and don't even know because you just didn't consider the fact that the hormones that are being administered to you are a replacement therapy. But hormone replacement therapy is what we refer to as HRT. And so letters have to be written for by therapists and psychiatrists and in our state, it's a therapist, a psychologist, and a psychiatrist. You have to have 3 letters in order to start HRT treatment, and they all have to be consistent with saying that you are expressing gender dysphoria. So we'll get into gender dysphoria and what that diagnosis looks like. But as a therapist, like what Dana was saying, we're looking for consistency in presentation. We're looking at insistence, that you've been insistently this person over time. And we're looking at what I say, insistent, consistent, and persistence. There's not a, y'all always ask, what happens if somebody just wakes up? No, in the therapy process, I want to know how long, okay, how consistent and how persistent you have been with your gender identity. Okay. And I want to know that any mental health concerns that you have are not related to your gender identity. Like me, as a cisgender female, I experience depression and anxiety, but not because of my gender. It's totally separate of my gender. The same can be for transgender clients, that they experience anxiety and depression due to other things that are not related to their gender. So I want to be, when we're looking at dysphoria, which we'll get into, we're looking for the dysphoria. That's one thing that you're looking for in therapy. You're looking for insistence, consistency, and persistence, right? So those are the 2 things that we're looking for when we're writing these letters for HRT. What if PTSD was ever a factor such as SA? So we would know that. We would know that. We would assess that. Me personally, I do a timeline for all my clients from as far back in childhood as they can remember to present. And if there's some trauma that could be related to that, that is something we will want to work on moving out of the way to be sure that the person's gender identity stands separate from the trauma. So that's why you'll need more than just one session, because these things could take a few sessions to figure out. I know Poetic RN says that it's standard in her state for 6 months, but in our state, there's not necessarily a standard for the amount of months. But before, like Poetic has said before we sign our name to say, yes, we believe this person would be a good candidate for HRT or gender reconstructive surgery, we have assessed that, they meet the criteria for gender dysphoria. And also there is consistency, persistence, and insistence on the gender identity that they identify with. Go ahead, Dana.
I didn't have anything to add. I thought that was lovely.
Oh, perfect. Perfect. I was looking at, if y'all got any comments, feel free to ask, or questions, and ask them.
I'm about comments too. Whatever.
Comments, right? Comments too poetic is getting their questions answered. But yeah. Okay, perfect. So yeah, we're gonna dive deeper into that, but just so you know the components that come with what a therapist is assessing. Because there's this idea that, oh, people that are trans are just making these um making these impulsive decisions, like impulsive big decisions that could impact their life forever. Well, no, unless you're doing something under the table, there is a lot of thought and assessment that goes into it. Again, 3 different letters from 3 different providers confirming not only that you have a diagnosis of gender dysphoria, but also that your identity has been consistent, persistent, and insistent. So these what if situations that y'all talk about, of what if they wake up one day and decide they want to detransition, it's not likely. Less than 1% of people that detransition, and it's usually due to some sort of social pressure. It's not because they actually don't identify with their gender. So the what aboutisms that y'all do are more unlikely than what you think. But that's okay. Y'all didn't know. You're learning now. Let's see.
There's lots of things in life that have like higher regret rates than transitioning and have significantly different wait periods. Tattoos are a really big one, right? You can just go anywhere and get a tattoo.
Yeah, I was just thinking tattoos. Let's see. Sandra says HRT is real. Even though I am not changing anything, it was really hard grasping my changes, mind, body, aging, and things I never thought about or problems with before. So yeah, so there's other people that don't identify as transgender that have also had a journey with hormone replacement therapy. Thank you for sharing.
Hormone therapy is really common in aging folks, you know, in dealing with menopause and menopausal symptoms, as well as low testosterone, and some of the other things that come with aging on both genders or both sexes.
Absolutely. Love it. I wanted to throw, since again, everything is about the kids and our concern for the kids, I wanted to talk a little bit about the Trevor Project. Okay. This organization supports LGBTQIA plus youth and has been doing so for 25 years. The Trevor Project is a great organization and great website to find out about different research regarding LGBTQ youth, and also resources for care, for gender affirming care for them, and also just who they are in general. So some of the things, if you put in the Trevor Project, it's the trevorproject.org, not com. Trevor Project, the trevorproject.org. You'll see who they are. Of course, a big pride proponent. They'll share their financial reports, who's on their team, how to contact them. What do? They provide crisis services for LGBTQ youth. Again, research. They conduct research studies to equip policymakers and LGBTQ youth facing professionals. There's public education. We help allies and educators understand the needs of LGBTQ youth and people. They also have advocacy efforts. They work to change hearts, minds, and laws in support of LGBTQ youth. There are peer supports. There's ways to get involved. There's ways to support them. There are resources here, such as blogs, research briefs, mental health surveys, news press, breathing exercises, and a host of other things. So definitely, yes, the trevorproject.org. Yes, thank you. Yes. Take a look at that too, Poetic. That might be something too. You might could use some of that information out of there for Saturday. But yes, the trevorproject.org specifically caters to LGBTQ youth. You can even find the definitions that we talk about on here, like non-binary, cisgender, transgender, all these terms that you hear us using. They also do have like a place on the website that explains to you what the different meanings for LGBTQ IA plus verbiage is. So definitely check it out for those of you that want to be more informed and not operate out of transphobia, right? Because if you're, operating out of ignorance and letting your ignorance speak out, that is a form of transphobia if you don't want to educate yourself. You don't have to, right? But understand, when you discount someone's gender or other than, you are engaging in transphobia. Okay? I'm going to leave that there. So yeah, the Trevor Project is a great resource. I like to redirect like parents of my parents of trans children to this site to help them get a better understanding. And it's a journey that they can take with their trans child in order to, walk through that journey of understanding together. So AAMC, that's where I'm at now, Poetic. And I'm not speaking just to Poetic. Everybody else can, but Poetic's going to be doing a live. But the AAMC helps .org helps us also describe what is gender affirming care. But before that, Dana, do you want to give us any more information on exactly what gender, maybe, because you gave us some for medical, you gave us some for socialization, and you also did give us some for mental health treatment as well. So you did cover it, but if you have any other information, I definitely want you to do that before I go to the AAMC.
Yeah. I think last thoughts, you said a diagnosis of gender dysphoria earlier. I believe, not to correct you in front of everybody, but the diagnosis is gender dysmorphia, which is just an incongruence in your gender assigned at birth and your presentation. Gender dysphoria generally refers to the sense of extreme unhappiness in your current presentation. It's the opposite of euphoria. And it is possible to have or to be transgender or non-binary without experiencing gender dysphoria.
Mm-hmm.
You can
you can be cisgender and experience gender dysphoria.
Mm-hmm. Yeah.
If you have PCOS and you have a mustache and you're a cisgendered woman,
yeah,
could be some dysphoria there.
If you get really weird about like your jawline, or like if you're a man and you can't grow facial hair, you feel like you're too skinny, there's lots of ways that people can experience gender dysphoria, and the same way that a lot of people can experience gender euphoria in different ways. And so it's possible to both have gender dysphoria and not be trans, and be trans and not have gender dysphoria. And so oftentimes, I think that is one of the biggest misconceptions, is that they're all just miserable and unhappy in their bodies. And it is possible to just want something better for yourself without necessarily being miserable about it, right? Mm-hmm. I can, want to lose weight and look better without being miserable and unhappy with the way I am now, right? Mm-hmm. And so that would be my only other real thing that I want people to hear from me today, is that it's okay to just seek euphoria and seek joy in your gender presentation, as opposed to having to just run from something that you just don't like and despise and hate so much.
Right. And I hope that those of you listening can understand how transgender individuals are more like us cisgender folks than different. Because again, we've talked about stuff that doesn't just apply to them, that cisgender folks could also experience or engage in, such as Dana just noted, gender dysphoria or hormone replacement therapy. That's not specific to transgender people. But when we start to talk about those things, it's we kind of start to run with our own idea rather than, that's why it's important to get factual information and not feelings-based information. That's why when I look up articles and things, I'm looking at peer-reviewed articles. This next article is from the AAMC, right? So we got to be careful to look at fact-based research and not feelings-based. So Google Scholar, right? PubMed, AAMC, NIH, the NIH, right? We got to look at things like that from an unbiased perspective to give us good research on these topics. Okay. And the research has to be younger than 10 years old, because once we get over 10 years, it starts to be less valid, just so you know. Somebody thought I was making a dig when I said that. Like, oh, people know how to read. It's not about knowing how to read, but people who haven't had to do research don't know really how to validate research, right? So that's one of the reasons I come. I do that work for you and then share it from reputable sources. Hold on, let me do my I want to get
Nobody's
my
going to write their stuff in a way that makes it sound unbelievable if they're wanting you to believe it. And there's nothing wrong with saying that research from many years ago is less valid. We just learn more things as we go along, and it has less meaning to look at something from 10 years ago when research is evolving so rapidly as it is now. And
exactly.
So even as somebody who's highly educated, it can be very easily to be led astray by something that seems pretty legit, or that, validates our biases that we may already have, and not be knowing about that. And so I always like to encourage people to learn more about research and how to read it then as well.
Right.
So
Right.
definitely not a dig.
And if you look at a research article, a lot of you may see that it actually, even though you can read the words, if you're not used to looking at research, it's hard to conceptualize what those words mean. And then you have statistical charts on there, which I know I wouldn't have known how to read if I didn't take descriptive and inferential statistics. Like, I wouldn't have known how to read that stuff, or even with the research that I had to conduct while I was in undergraduate and graduate school. Like, they teach you how to write those articles, will teach you how to conduct research and prepare, research articles, so that you do know how to read them, so that you do know how to do them. And most people didn't necessarily get that education. So it's not a dig at all to say anybody's dumb. It's just that reading a research article is not necessarily as straightforward as reading a book. That's all. Let me grab my DSM-5 real quick. All right. We're going to go, let me see if there's anything else that the AAMC outlines that is digestible. Oh no, we still do have, when we're talking about sexual dysfunction, it's not the sexual dysfunction. So we do have gender dysphoria, which that is, we'll get into the gender dysphoria as opposed to gender dysmorphia. We do need to get into that, but I know that insurance panels want you to have a diagnosis of gender dysphoria in order for them to proceed with funding for your for transgender care. But we do want to talk about the difference between gender dysphoria and gender dysmorphia. Okay, so we'll get to that when we do get to the dysphoria piece. But thank you, Dana, definitely for pointing that out, because that's important. Oh dang, what happened? Okay, let's go to see if the AAMC outlined any more specifics, because I had 3 different things pull up. Okay. Let's talk about what is gender affirming care. All right, gender affirming care, as defined by the World Health Organization, or WHO, encompasses a range of social, psychological, behavioral, and medical interventions designed to support and affirm an individual's gender identity when it conflicts with the gender they were assigned at birth. See that? Because it really should say sex that they were assigned at birth, and that's why people conflate the two, but it says gender. The interventions help transgender people align various aspects of their life, emotional, interpersonal, and biological, with their gender identity. As noted by the American Psychiatric Association, or APA, that identity can run anywhere along a continuum that includes man, woman, a combination of those, neither of those, and fluid. Now, this ain't me, y'all. This is the AAMC saying this, okay? Let me read it again. Or actually, this is the American Psychiatric Association saying this. That gender identity can run anywhere along a continuum that includes man, woman, a combination of man and woman, neither man or woman, or fluidity between man and woman, okay? That's not made up. Y'all can look this up on aamc.org under gender affirming care, okay? The interventions fall along a continuum as well, all right? Let's talk about the interventions, because people go straight to surgery and removing parts. But like Dana has expressed, and like the AAMC is now expressing, okay, so you know that the information that Dana gave is valid, saying the same thing. I thought there was a question. Oh yeah, aamc.org. Thank you. Yeah, aamc.org. Thank you. The interventions fall on a continuum as well, from counseling to changes in social expression, like Dana was talking about, as far as like it could be a haircut, it could be a change of wardrobe, things like is minimal as that. To medication such as hormone therapy, which is what we've talked about. For children in particular, the timing of the intervention is based on several factors. Since we want to talk about the kids, y'all always want to focus on the children. Let's focus on them, okay? Let's focus on the kids. For children in particular, the timing of the intervention is based on several factors, including cognitive and physical development, as well as parental consent. Surgery, including to reduce a person's Adam's apple or to align the chest or genitalia with their gender identity, is rarely performed for people under 18. So y'all can get y'all's panties out of a wad, because they're not performing surgery on children under 18 unless it's some sort of under the table thing, right? So get your panties out of a wad.
Can I?
Go ahead. Yeah. Go ahead.
I read something one time, and it was talking about most of the reason why these surgeries will be performed on somebody under 18 is like they're 17 and have been presenting like this for a long time, and they're about to go to college and want to be able to, start college with um, the presentation that they want. And so people will look at them and just say, like, you are gender identity that you present as, that you identify as opposed to like, they're just randomly doing this on like a 6-year-old.
Right.
Right. It's
And that's what
often
people
a very
think.
kind of close.
People think that's what's happening. Like a 6-year-old can just come up and say, Mom, Dad, I am a boy or I am a girl. And the parents are like, okay, let's go on ahead and get you that surgery. It doesn't work like that. It doesn't at all work like that, guys. There's a lot of intentional treatment that goes into that sort of transition. There's age to consider, the other things that we've talked about, insistence, consistence, persistence, and a diagnosis by 3 in just Alabama, by 3 different providers in order to move forward with that kind of treatment. Okay. It's not just as frivolous as y'all think. Why do youth seek gender affirming care? Some children sense a difference between their assigned gender and their gender identity at an early age, says Dr. Adkins, director of the Duke Children and Adolescent Gender Care Clinic in Durham, North Carolina. By the time an adolescent or teenager comes to the clinic to talk about gender affirming therapy, they've typically been thinking about it for a long time, says Adkins, whose clinic is part of Duke University Hospital. Those who seek gender affirming care are often experiencing gender dysphoria, which the APA cites as psychological distress stemming from the incongruence between gender assignment and identity. Although many transgender people feel this distress without being diagnosed by a doctor, gender dysphoria is a defined clinical condition in the APA's Diagnostic and Statistical Manual of Mental Disorders. That is the book that I have here. Okay. This is my desk reference. I have a big one, but this is my desk reference. Go ahead, Dana.
You were correct. It is gender dysphoria. I thought it was dysmorphia. Maybe it was in 5 and not in 5TR. But
well, let's look at it still. We're still going to look up gender dysmorphia.
I've got it.
Oh, you got it? Cool.
Yeah.
I'll do dysphoria. You can do dysmorphia when we get to it. Yes. I wanted to be sure.
Oh, I don't think dysmorphia is in here.
Yeah, it's not.
It's under like
it's not in the it's not in the DSM-5 TR. It's literally just like 2 pages for gender dysphoria.
They still do have body dysmorphia.
Body dysmorphia
is slightly different.
Yeah. Which there could transgender people probably could. They could also experience body dysmorphia, but
they definitely can. Mm-hmm. But generally with body dysmorphia, it's on perceived negative things like, oh, my nose is just so ugly, it's so big, like look at how like outrageous and bumpy it is, and everyone's like, girl, you're fine.
Yeah.
And changing it won't actually fix my perception is the difference usually.
Yeah. And usually when we talk about, usually when we think of body dysmorphia, we think of like folks like Michael Jackson or people that could be dealing with an eating disorder. We look at, body dysmorphia more around, situations like that. But for the diagnosis, in order for insurance to pay for transgender individuals, they do want to see the presence of gender dysphoria as the diagnosis, because that's the not CPT, diagnostic code. Because in order for you to bill insurance, you have to have a diagnostic code. So I'm not going to get into all that with you, but Dana knows plenty about it. But
just insurance things.
just so y'all know. In school, gender dysphoric youth often struggle to succeed socially and academically due to pressures to dress in a way that associates with their assigned sex at birth, or out of fear of being harassed or teased. The Minnesota-based Mayo Clinic, you can also look up things on mayoclinic.org as well. When it comes to getting help, Mayo notes, accessing health services and mental health services can be difficult due to fear of stigma and lack of experienced care professionals. So, all care providers, all therapists, all RNs, like poetic, all MDs are not trained in gender affirming care, right? But it's easy for people to slap their title on something and say they know something, which can be very dangerous. If you don't provide gender affirming care, but you happen to be a therapist, a nurse, a doctor, and you're just speaking from opinion, please don't do that. It's very dangerous. Let's see. I'm not going to read the whole thing. I'm going to just take out key points because you guys can look up this article, Gender Affirming Care, on aamc.org, and you can read the whole thing yourself. This is not a research article, so it should be easy for you to digest. What types of emotional, social, and psychological care are available? The fundamental thing that transgender people seek from their health providers is someone who's culturally and medically competent to care for them in an environment where they feel safe, says Mbach, whose LGBTQ clinic is part of University of Iowa hospitals and clinics. The primary care I provide is a gender affirming environment. So somewhere where transgender people can feel safe, where they can feel understood, and they can feel that they're receiving the treatment that aligns with their gender identity. Okay, simply put. So I think that as far as gender affirming care, because Dana did a fabulous job of talking about the rest of this in a digestible manner. But the article literally reiterates what we were already talking about. So, any questions, or Dana, did you have anything else to add to the gender affirming care before we got to the dysphoria piece?
I think that's the part about needing a place where people are just educated and where they feel safe is really all any of us want, right? Whether it's any kind of marginalized group, whether it's queer, trans, people of color, people of different ethnic or cultural backgrounds, or, like I work in substance abuse, if I'm not educated, I could very easily say something that could be really hurtful towards one of my patients, right? There's a lot of misconceptions about substance abuse the same way that there is about trans folks. And so it'd be very easy to do something like that. And so ultimately, the best thing that any of us can do for the people in our lives is to educate ourselves. And I think that being here and being part of this live and listening to us talk for a while is an excellent first step. And so I thank you guys for being here. Absolutely. Please share this live as well. Okay, friends, family, coworker, mother, sister, daddy, brother, cousins, they, them. Share it, because this has been very informative and very good. And for those of you that will be in the live on Saturday to talk more in depth about the hormone treatment part of it with Poetic RN, hopefully this will help with you understanding the process. Gather all the girls, gays, and theys. Yep, all the girls, gays. Girls, hey, Candy, I taste just like candy. I love it. If a person is a minor, would they start HRT on them or wait till they are 18?
So I'm going to let Dana reiterate that point because we literally just talked about that. Go ahead, Dana.
Yeah, so it really depends on the age. And so if they are prepubescent, if they have not yet started puberty, it would often just be social adjustments. Once you kind of get into that puberty, you can start with either puberty blockers, which will delay puberty until the medication is stopped. And after a certain amount of time has passed and depending on all of the laws and restrictions in your state, you may be able to start hormones. That generally doesn't tend to happen until I think the earliest I've seen is like 14, right? But it's really a 14 to kind of 17 thing. In Alabama, we have to wait until 19 because of laws and restrictions. But oftentimes it is more social changes up until a much older age than you would often think of. So,
Yep. Dana did give an example, like if someone's 17 and they're about to start college and they want to start college with their new presentation because they're starting off fresh in a fresh new world. That could be a possibility. We talked about puberty blockers, but with HRT and surgical measures, more so around the 18 years old and older mark. So yeah. Yeah, it's unfortunate with Alabama. We do definitely suck. Yeah, we do. Yeah, I agree. I started when I was 15, but got my meds from the black market. Exactly. That's why I said, with the conventional methods, there is that age, but there's not to say that people can't get stuff done under the table or off the black market, which that is a big thing because a lot of what gender affirming care, the whole the bigger goal with it for me as a professional is saving a life, because people that are experiencing gender dysphoria to a point where they don't want to be here. That's a big thing for transgender youth. A lot of them experience suicidal ideation when they don't have access to that affirming care. So it can be dangerous. Okay. It could shorten a trans youth's life to not receive gender affirming care because they could get tired of it and take their life. And that's a high rate. Is it about 63%? I can't remember.
I'm not sure what the overall percentage is, but
Dana froze. They're coming back. Too bad they have to turn to black market and not go to right. It's super sad. But shoot, if we get limited things, we're gonna be going to the black market for a lot of things, including if we are pro-choice people and want to choose, right? That might end up being a black market thing. And already had Can y'all, okay, I can't talk about that. Can y'all tap the screen? Tap the screen for me. I had got a violation. I can't talk about under 18 years old stuff. So, yeah. Y'all got the gist. Dana's back. All right. Can y'all, tap my screen so they know it's a real live and we're not, promoting anything bad. All right, go ahead, Dana.
I was going to say, I don't know what the exact percentage is, but I did my poster presentation that I had to do, my research presentation for my degree on working with transgender youth in the light of the Alabama restrictions. And one of the biggest things that helps to prevent the attempt of transgender youth to be in supportive environments for people that support and understand them, especially their family. And so that goes back to what we were talking about earlier about this morning, a safe and understanding environment.
Perfect. Thanks, Dana. Our last point, we're just going to wrap it up in a bow with going over the gender dysphoria diagnosis, just so y'all will have a general understanding of that. I have it here, but I also have it pulled up here. Thank you so much. Thank you for the gifts. I appreciate y'all. Let me go to over here. And this will be our last point. We have gone a little bit over, but this has been very informative. And hopefully has helped a lot of you gain a better, more clear understanding. So this article is psychiatry.org. Okay, so the APA, American Psychiatric Association, that's where this article is coming from for gender, what is gender dysphoria? So again, that is psychiatry.org. For those of you that would like to go behind me, I encourage you to go behind me and see it for yourself. That's why I give y'all the names of where I'm reading these articles from. All right, so let's go down to the diagnosis. All right, the DSM defines gender dysphoria in adolescents and adult as a marked incongruence between one's experienced/expressed gender and their assigned gender, lasting at least 6 months. That's probably where the 6 months comes in for you in your state, Poetic, because in order for gender dysphoria to be diagnosed, it has to be experienced. That incongruence has to be experienced for at least 6 months. So that makes sense. That makes sense. As manifested by at least two of the following. So for 6 months, the person has to experience two of the following symptoms: a marked incongruence between one's experienced/expressed gender and primary and or secondary sex characteristics, or in youth, adolescence, the anticipated secondary sex characteristics, a strong desire to be rid of one's primary and or secondary characteristics because of a marked incongruence with one's experienced/expressed gender, or in young adolescents, a desire to prevent the development of the anticipated secondary sex characteristics of the other gender, a strong desire to be of the other gender or some alternative gender different from one's assigned gender, a strong desire to be treated as the other gender or some alternative gender different from one's assigned gender, a strong conviction that one has the typical feelings and reactions of the other gender or some alternative gender different from one's assigned gender. In order to meet the criteria for diagnosis, the condition must also be associated with clinically significant distress or impairment in social, occupational, or other important areas of functioning. The DSM-5 defines gender dysphoria in children. Since we want to talk about the children, let's talk about the diagnosis of gender dysphoria in children. The DSM-5 defines gender dysphoria in children the same way: a marked incongruence between one's experienced/expressed gender and assigned gender, lasting at least 6 months. Insistence, consistence, and persistence. It's not a wake up one day and I want to be a different gender. 6 months of insistence, consistence, and persistence, okay? A strong desire to be the other gender, or an inconsistent that one is the other gender. In boys, assigned gender, a strong preference for cross-dressing or simulating female attire. Or in girls, assigned gender, a strong preference for wearing only typical masculine clothing, a strong preference for cross-dressing, roles in make-believe play or fantasy play, a strong preference for toys, games, and activities stereotypically used or engaged in by the other gender, a strong preference for playmates of the other gender. In boys, assigned gender, a strong rejection of typical masculine toys and activities, and a strong avoidance of rough and tumble play. Or in girls, a strong rejection of typical feminine toys, games, and activities, a strong dislike of one's sexual anatomy, a strong desire for a physical sex characteristics that match one's expressed gender. As with the diagnostic criteria for adolescents and adults, the condition must also be associated with clinically significant distress to impairment or social / occupational or other important areas of functioning. So there y'all go. There y'all go. All right. Thank you so much, Dana. I'm going to let you slide because we have kept you longer, but are there any last points you'd like to make?
I don't think so. I mean, we've gotten pretty good in depth here and covered a lot of the things that I didn't think that we would have time for since we took some extra time. But yeah, I think the only other thing is, oftentimes, like I said earlier, it can be going so much against the grain to, identify yourself as being transgender. Oftentimes, one of the things that people will say colloquially, this is not something that therapists use. As we've mentioned, we have to see the insistence, persistence, and consistency. But they say if you could right now push a button and wake up tomorrow in a different gender and just have everybody accept that, and that's the way it is and the way it always has been, would you push that button? And what's really that's asking is if you could do that without the social stigma, without all of the hoops and ladders and all of the issues that you know that you'll face going forward, is that something that you want? And if you consider that your answer to that might be yes, then maybe that's something for you to consider and explore what it is that you like about your gender, what it is that you maybe don't like about your gender, and how you can go about accommodating yourself in that, whether that is a full transition or just deciding that maybe you like different pronouns. Mm-hmm. And so, exploration is not the enemy. We can all learn more about ourselves. And even if you are cisgender and you really like your gender, be more secure in that and kind of understand and appreciate that more once you've given it a little bit of scrutiny. So,
yep. Mm-hmm. Perfect. Thank you, Dana. I know this was very informative. Those of you that missed the beginning of the live, you can feel free to go to our, click the link in my bio and go to my IG or go to my Facebook, and the replay will be up there so you can see the entire live from the beginning if you came in after we started, because it doesn't save over
on
here.
Instagram too.
Yep. You can go to click the links in our bio and scroll all the way to the bottom, and all of our social media platforms are there. Instagram and Facebook is where you'll be able to watch the replay of today's live. Thank you so much, Dana. Thank you. Get well soon.
I'm going to do my best.
I'll talk to you probably tomorrow.
Hopefully.
All right. Bye.
Okay, bye.
So there y'all go. I'm going to stick around for more questions. Dana just has to early and also is not feeling well. So I'm here. But Dana is very good at was very good to help me facilitate this conversation, be sure I didn't miss any points. And the articles that we went over also validated the fact that I didn't miss any points, because we covered gender affirming care. We covered what is gender dysphoria. We covered what does gender affirming care look like in medicine and mental health. We talked about what does transphobia look like. All right. And we phrased it all around the kids, since y'all so worried about the kids. We focused on the treatment for the kids, okay? I will let Dana know. Thank you, Poetic. Thank you for being here. Thank all of y'all for being here. I really appreciate the people that came and really wanted to learn. And then we can go into Poetic's live on Saturday, at least having a clearer understanding. Yes, Poetic, and thank you for Saturday. I'm gonna definitely be there. If it It's 8 a.m. Eastern, though. It's not 8 a.m. Pacific, right? Is it 8 a.m. Eastern for your live on Saturday? Poetic is a RN that works in endocrinology. So this is, she works with hormones and different parts of the brain that handle hormone excretion and all of that. So, of course, this is a conversation she'll be able to contribute to more on the medical side. Okay, so Poetics Live is going to be at 8 a.m. Eastern, okay, which is 7 p.m. Central, okay? 7 p.m. Central, 8 a.m. Eastern, over here on TikTok Live, okay? Perfect. She going to be doing a big old giveaway too, so y'all better be there. All right, let me see. Sandra asked, what is the difference in all the labels of LGBTQ? All right, so we talked a little bit more in depth about that, but generally with the LGBTQ population, we're talking about folks that don't subscribe to gender norms for sexual identity, sexual preference, or sex in general, okay? So it's 3 different components to being in the LGBTQIA plus community: preference, gender identity, and also sex, okay? But of course, the L is for lesbian, the G is for gay, the B is for bisexual, the T is for transgender, and the Q is for queer, because of course, all of this is on a continuum. Sex, identity, preference, all lies on a continuum of things. So those of us who don't identify with the majority norm, as far as those things are concerned, we would be in the LGBTQIA plus community. Does that answer your question? Poetic's going to be giving away $500, y'all. $500 Saturday. So y'all better wake up at 7 a.m. Central, 8 a.m. Eastern, 8 a.m. Eastern, 7 a.m. Central, so y'all can get in on that, right? Because that is a huge chunk of change. I know I'm going to be there. I'm going to give y'all a little something tonight. It ain't going to be 500, but it is going to be a little something, okay? Yeah, any other questions? That therapist wig, what you got to say? That wig needs some moisture and a good brushing. Okay, well, why don't you do it? That therapist wig. Why don't you moisturize it and brush it? How about that? How about you must moisturize it and brush it? Thank you for being here. Thank you for being here, that therapist wig. I love that I have trolls. That means that I've made it. You ain't made it unless you got haters. That therapist wig can't even come in on a real page. So why don't you brush it out and moisturize it while you stand behind that fake page? How about that? Moisturize it. Do that. Yeah. All right, y'all. Any other questions, comments? I came in a little late, but I definitely go back and watch from the beginning. Yes, the replay will be up. So that y'all can get that information, okay? Who is this? Oh, come on up. Hey there.
Hi, how are you? I do believe that we should definitely talk more about the cons of the black market, right? Because for me, right, I didn't have to go through the steps of getting letters, and I feel like, yes, like my decision. I was proud of it. I'm still proud of my decision. But I think like if I was able to do the letters, it would have slowed me down and be able to like, you know, go to the sperm bank or like save my sperm so I could have kids in the future, right? Because I was young, so I wasn't thinking about kids, right? So for me, I was like, okay, I don't want no kids. I don't really care. So this is the decision I made. I went to the black market and got my bilateral orthoectomy, right? At the age of being a minor. So I do feel like that is a con, right? Because it's not a good thing, right? But if I felt like if the black market still was able to tell me like, listen, go get the letters, it would have slowed me down, made me think about things, you know. So I think letters are important because look at me now. I'm happy with my decision, but I'm also sad that I'm not going to be able to have my own kids biologically. You know what I mean? So that's one of the like the cons I feel like the black market does do.
Yeah, thank you, Candy, so much for that. And it's like Candy saying, it wasn't like a con, like, oh gosh, I didn't mean to do this, but like, oh, what can I preserve before I make this decision in case I want to have other decisions available later in life. So yeah, thank you so much for sharing that.
You're welcome. Bye.
Yeah.
Thank you.
You're welcome. Thank you. So yeah, we do not want black market engagement. We really want people to be able to get the care that they need in a well evaluated manner. However, with the laws and things that may come into effect, people will become desperate, you know? So that's why it's very important as an ally or as somebody who wants to support transgender individuals. The best way you can really do that is with your votes, okay? Because don't think that if you voted out of office that it's going to go away, because it definitely won't. We're going to just be like Handmaid's Tale around here and people using hangers, okay? That's what it's going to result in. So if you think you're going to vote it away, it's not going to happen. So if you care about people's lives, if you want to advocate with your vote and advocate with educating yourself. Okay, advocate with your vote and advocate with educating yourself. Those are the two best things that you can do to help preserve this population of people. Y'all, transgender individuals only make up about 1% of our population. They're not taking over. I know some of the transphobic ideology is, oh, they're going to take us over. They're not. It's only 1%. It's 99% of us that's cisgender out here, okay? The cisgender folks ain't going nowhere, right? So y'all can rest assured, okay? Any other questions, comments, or concerns? Questions, comments, or concerns? To set an appointment with Dana, but it would be out of pocket. So much knowledge. Yes, you can still make an appointment. You still can make an appointment. We have other therapists that are as phenomenal as Dana. We definitely do. We do. All right. All righty. Cool. Well, y'all know what it's time for. It's time for the Cash App giveaway. Right? It's time for that. Y'all been here with me. Y'all stayed with me overtime. So now it is time for me to reward you. Y'all know what to do. Facebook and Instagram, y'all had different instructions. If you're in our text community, right? Your instructions for entering the Cash App giveaway came through via the newsletter or via the text community. For you over here, you have to be a subscriber. I will put the comments on sub only, but before I do that, If you're a subscriber, here are the rules. Only put your CA one time, just one time, okay? If it blocks it, I will see it. If it blocks your comment, I will unblock it, okay? You don't have to put it twice because it'll make it take longer. Only put it once. If it blocks it, I promise you I'm able to see it and I can unblock it on my end, all right? Thank you, Queen Mapson. You know I love you down. I'm glad you enjoyed it. I'm glad you enjoyed it. Let me put the comments on sub only. Members, subscribers, put your CA in the comments once I get it on sub only. And then Facebook and Instagram, they had different rules. Yay! I love you back. Not I don't want to take from Nay's allowance. Nay doesn't take any money from me. That's so crazy that anyway, Nay doesn't take from her allowance. I'll just leave it at that. Because when a person really likes you, they don't want to just take from you. That's not how that goes. But anyways, go ahead. Hold on, I will undo it. So yes, y'all over here, put your CA in the comments. You only got to put it once. If it blocks it, I will see it and I'll unblock it. And y'all know what to do over here. You got your instructions. Let me grab my handy dandy notebook. Her dog, get off my couch. All right, so I'm gonna start over here. Listen, guys, I want y'all to listen close. I'm only gonna say your name and your number 2 times. So it's time for everybody to open their ears, open your ears, because I'm only gonna say your name and your number 2 times. Now, if I mess it up, I'll say it 3 times. Like if I fumble over your name or something, or cough or something like that, then I'll say it 3 times. But other than that, I'm only going to say it twice. So if you miss your number, oh well, because I have told you to listen before I got started. Okay? All right, let's get it started. Let me start over here. All right, who is this? Let me see. Treasure with Love Jewelry, number 1. Treasure with Love Jewelry, number 1. Okay. Go over here. Sharon Gray, number 2. Sharon Gray, number 2. Chrissy Davis, number 3. Christy Davis, number 3. Christy Davis, number 3. Let's see, let me go up. Toya Betts, number 4. Toya Betts, number 4. Make sure I didn't miss no one. I think I got it. All right, let me go over here. Paige, number 5. Moderator Paige, number 5. Moderator Mama Nee, number 6. Moderator Mama Nee, number 6. Poetic RN, number 7. Poetic RN, number 7. NINI, Nini, number 8. Nini, number 8. That's NINI. Chris Cass, 86. Number 9. Chris Cass, 86, number 9. Oh, that therapist wig, I'm sorry, you're not subscribed, so you will not be able. Not that therapist wig stuck around the whole time. Hopefully they learned something. Oh, okay. I think that's it. That's it. All right. So we got 9. We got 9, okay? We got 9. I don't think I missed anyone. Pretty sure I didn't. Okay. Now y'all know how this goes. Especially since I allow my moderators to be in it. Let me show y'all everything from start to finish. So people, in case one of my moderators win, y'all know I don't play favorites. Y'all know it's completely fair. So let me flip my camera. What is it? All right, here. Whoop. All right, and then let me share my screen with the folks over here so everybody gets the same view. Everybody gets the same opportunity and view. Let me see. Okay. Share screen. Okay, new tab. Perfect. Now everybody can see. Everybody's looking at the same thing now. So we're going to do random number wheel generator. All right. And it's 9. Okay. Good luck, everyone. Let me show these people over here. All right. Drum roll, please. Drum roll, please. Number 4. Who is number 4? Who is it? Who is number 4? Who is it? Who is number 4? I feel like it was a Facebook person. Remember, I don't know what your numbers are. I had to say them. That's why I said them twice so you could keep up with it because I don't know who. Who is number 4? Who is it? It's you? Yay! It's Toya Betts. Congratulations, Toya. Is this your first time to win, Toya? I feel like it's not. Hold on real quick. I feel like it's not your first time to win. It's $100. 100. I got y'all on $100. Toya just won $100. A smooth Hyundai. Is this your first time to win, Toya? Let's see. Y'all do like my nails. You're so cute. All right, let me do 100 to... I didn't think it was your first time. See, people that rock with me have won multiple times, y'all. That's what I'm saying. Keep coming around and learning you something, and you can win multiple times too. Congratulations. From Yellowbird Counseling with the 3 yellow hearts. And then I show everybody that is sent. Sent. And then Toya is going to tell us when she receives it, so we make sure it went to the right person. Cash App giveaways don't have to be complicated. All right. Did you get it, Toya? Tell us when you got it. Hold on. Toya said, nope, it's not her first time to win. Tell us when you got it. Did you get it? Hold on. Tell us in the comments when you get your Cash App. You got it? Toya got it. Yay! All righty. Toya got it. Whew. Wait, hold on. Okay. I had to fix my bang. This wig got baby hairs already in it. You know what I'm saying? All right. So, yay! Perfect! Toya got it. All right, y'all. So grateful to have all of y'all. Thank y'all for sticking with me. We went overtime. If you do want to view the replay, if you came in late, you can click the link in our bio, scroll all the way to the bottom, and you can look at it on our IG or on our Facebook. The replay will both be on our IG and our Facebook. Why did I? What? I don't know. Okay. All right. Perfect. And then next week, I'll come to y'all with another lovely topic at 8 p.m. Central, which is 9 p.m. Eastern, which is 6 p.m. Pacific, which is 7 p.m. Mountain. Y'all stay warm and be safe out here. Okay? Have a careful